Hi, this morning, my name is Daniel Mensa, and this morning we are going to look into Unit 1 of the Learning Outcome 5, Leading and Managing of Health and Social Care. The unit will develop the knowledge of the key concepts, theories, and models of leadership, which we've spoken about. I've also explained that there are categories of which the learner would have to make sure they reach those learning outcomes that may lead into a pass, merit, and extension category. Okay. For learning outcome 4, we are going to look into how the learner can understand to lead and manage the healthcare and health and social care service, which has 3 learning units within 4. We have the 4.1 that seeks to explain the features of effective business and resource management. We have the 4.2 that explains the process of observation in making effective decisions. And then the 4.3, we have the analysis to analyze the features of a positive value-based culture and how it impacts the management of health and social care service. Whilst the merits got over distinction, then we need to look into assess the strategies to balance profit-based approaches with a positive value-based culture and context. Okay. So these are things that we expect learners to do. So thereby we are saying that to understand how to lead the managed health and social care service, we have the internal and external influences of leadership. We are going to look at the overview management functions, which is human resource, job description, performance review, staff development, quality and diversity, financial management, and so on. Then we have resource use, accurate forecasting, we have management of patient staffing, decision making, the meeting strategies, and all that. Those are things you are going to look into today. Right, guys? Okay. So let's go into lectures. Let's see what we can achieve today. The learning outcome 4. So learning outcome 4, we've already had into assignment brief and a specification. Then we're going to look into some definitions and some key areas for which we look into. So some key areas of leadership and management. Strategies and planning of patient leadership and management. Okay. Now we have strategic planning and vision. Definition: developing a long-term vision and strategy plan of the service for the service. Application: setting clear goals, identifying priorities, and aligning resources to achieve these objectives. Example: a care home manager creating a 5-year plan to improve care quality, expand services, and enhance staff training. Okay. Operational management. The definition, therefore, would be that overseeing the day-to-day operations of the service to ensure efficiency and effectiveness. But the application, therefore, would be that you have to look into implementing policies, managing budgets, ensuring compliance with regulations. What then would be the example? Ensuring that staffing levels are adequate to meet the needs of residents and that of staff are trained in a current best practice. Definition: continuously monitoring and improving the quality of care that has been given. And in monitoring, its application will be that you have to use audit trails, feedbacks, performance metrics to identify areas for improvements. Example is conducting regular care quality audits and implementing improvement plans based on the findings. Okay. Regulatory compliance. The definition, therefore, is ensuring that the service meets all relevant legal and regulatory requirements. The application will be that staying up to date with changes in legislation, implementing necessary changes, and maintaining documentation. So one of those examples would be that when a care home decides to comply with the Quality Commission standards and regulation for inspections, those will be an example under regulatory compliance. In financial management, we're seeking to monitor the financial resources of the service effectively. Okay, managing the resource effectively. The application there will be that you are managing forecasting and financial reporting to ensure sustainability and accountability. Okay. Yes, that's what you're seeking to do. An example would be that you are developing a budget that balances quality care with financial constraints. Developing a budget that balances quality care with financial constraints. Human resource management. Definition includes recruiting, training, retaining a skilled and motivated workforce. Recruiting, training, and retaining a skilled and motivated workforce. This application will be that you are implementing HR policies, providing professional development opportunities, and fostering a positive work environment. Okay. Example would be that offering regular training sessions and career development programs to staff. That indeed is a very key thing. Okay. In HR management, we need to be looking to the staff development. That is the key of the organization. Okay. Stakeholder engagement. Stakeholder engagement. Definition: building and maintaining relationships with key stakeholders, including service users, family, staff, and external partners. Building and maintaining relationships with key stakeholders, including service users, family, staff, and external partners. And that is stakeholder engagement. So we have internal stakeholders and external stakeholders. This application, therefore, will be an effective communication, involvement in decision making, and collaborating with external agencies. An example would be that Holding regular meetings with resident families, discuss concerns and suggestions. Sometimes even local authorities as well. Change management. This definition will be that you are leading and managing change within the service to adopt new challenges and opportunities. The application will be that you are planning and implementing change initiatives. Okay. Planning and implementing initiatives, supporting staff through transition, evaluating outcomes, and even trainings and orientation so they could understand the changes that has been provided or that will be ongoing. Example, introducing new technology to improve care delivery and training of staff to use it effectively. Okay. To use it effectively. So you train them, you get them orientations and all that. Okay. Get-to discussion. Strategic planning and vision. The importance. Provides direction and a framework for decision making, ensuring that the service remains focused on its long-term goals. Okay. So in strategic planning, we are giving the organizations or the service a sense of direction strategically, putting some decisions just to meet the company's organization's core mandate and vision. Okay. Operational management, you are looking to the day-to-day activities of organization. So really the situational issues that comes. We spoke about situational leadership, yesterday. So situational issues that come on day to day, you are putting issues into practice and making sure that things are on a day-to-day basis. Okay. So issues, procedures, policies, email management, everything within is more operational. So most times, while strategic planning may be top management level, the operational may be the supervisors, the team leaders, and all that, those are the general staff level. Quality assurance and improvement. There is a need for continuous improvement within the organization. Factories do that and all that. And quality is one key thing that is very important in healthcare and in all the organization. So continuous improvement, quality of care, just to maintain higher standards of care and achieving better outcomes for service users is very key. Okay. The approach is to utilize those various tools and techniques such as audit feedbacks loops and other organization and other performance metrics to identify and address those areas of improvement. But regulatory compliances, as we have always said, they could be the CQC compliances, it may be the legal framework compliances, it may be the local authority compliances and all that. So these are compliances that we have to adhere to, getting ourselves abreast with all the changes as required before any inspection is made. Okay. Financial management, we spoke about that. Financial management is managing the finances of organization. We spoke about how important it is. It involves budgeting and forecasting, expenditures and all that. What we say human management is more about skill development, training development, and all that. So there should be effective HR, management skills, recruitment, retention, training, creating positive feedbacks, and all that. Stakeholder agreement, we spoke about that. Okay, it has importance It builds stronger relationship with stakeholders, support enhances service reputation. Approaches are regular communication involving decision making helps. Change management, its importance will be that successfully it manages the change essential for adapting new challenges. Of course, once there's a proper change management procedure in place, it's able to transition and manage the transition manner between the old and the new. Okay, where the approach was clear, the supporting staff through transitions and evaluating the impact of changes to ensure they meet the end goals. Okay, so in conclusion, effective management and leadership in health and social care requires a comprehensive approach that integrates strategic vision, operational expertise, and strong interpersonal skills. By focusing on strategic planning, operational management, quality assurance, regulatory compliance, financial management, human resource management, they are all properly adhered to and they meet the both staff and service users. Explain features of effective business and resource management. Effective business and resource management in health and social care ensures that services are delivered effectively, sustainably, and high quality. Okay. This involves accurate forecasting, technological integration, sustainable practices, and robust management of daily operations. Okay. These are the features of. Now, when we talk about resource use, relative to accurate forecasting. Okay. A better definition of it will be that the process of predicting future needs based on historic data, trends, and anticipated changes. Okay. What then will be its application? Its application will be that you are ensuring sufficient resources, staff, equipment, budgets are available to meet demands. Example are using historical patient admission data to forecast staff needs during peak times. Okay, so you look at the admission record and all that, and then you're able to forecast the staff needs because the number of patients that is called a particular ward, on a regular basis, within a month, within a day, you can tell how many staffs that you feel you may need, during peak, probably maybe be during December, during some peak periods. There's always high tendency of patients calling at your ward, and therefore you have to look into it and see how you can assign or request for more human capacity staffs. Okay. Use of technological tools in planning. Definition. Utilizing software and other technologies to streamline planning and resource allocation. Application. Implementing tools like electronic health records, EHR, scheduling of software, and resource management systems. Example, using an EHR system to track patient care needs and ensure adequate staffing, equipment availability. Okay. Definition. Implementing practices that ensure long-term viability and minimal environmental impact. Application. Reducing waste, conserving energy, and using eco-friendly products. Implementing recycling programs and using energy efficient appliances in the care home. Okay. Definition. Planning to ensure that operations can continue during and after a disruption. Application. Developing and maintaining business continuity plans to handle emergencies. Okay. Example, creating a detailed plan for continuing care during a natural disaster or major IT failure. This may be the business continuity, okay? Yeah, okay, so whilst we're able to plan to ensure that operations can continue during and after disruptions, and application will be that developing and maintaining business continuity to plan and handle emergencies. You create a detailed plan in place, a backup plan, okay? Management of operations, where ensuring that the care home is adequately staffed with qualified professionals. But through what means recruitment, training, caring of staff to meet the needs of the residents. Example, using scanning software to manage search rotations and avoid understaffing. Okay. Administration, effective management of administrative tasks to support care delivery through implementing efficient processes for documentation, billing, and regulatory compliance. What then would be an example? An example would be that you're using an integrated administrative software system to manage resident records, billing, and compliance documentation. Okay. Definition: maintaining a clean, safe, and comfortable environment for residents. Application: implementing cleaning schedules, safety protocols, and maintaining routines. Okay. And maintaining routines. Example would be that you're using a digital checklist for housekeeping staff to ensure all areas are cleaned and maintained regularly. Okay. Communications, effective internal and external communication strategies. Those are key. Through ensuring clear communication channels between staff, residents, families, and external partners. Example, implementing a communication platform for staff to share updates and coordinate care. Okay. Implementing a communication platform for staff to share updates and coordinate care. Contingency planning. Now, definition where you prepare for an unexpected event that could disrupt operations. Scenarios, set staff, social equipment failures. The example, therefore, would be that you need to create a backup staffing plan for when regular staff are unavailable due to illness or other emergencies. So while the definition is you preparing unexpected events that could disrupt operations, unforeseen things that may happen within the organizations, okay? You prepare for them. You put in a contingency plan, another plan in place for such occurrences. In doing that, the application with that, you have to develop those contingency plans for various scenarios, such as staff shortages or equipment failures, okay? When they are stop, what do you do? Do you have internal staffs or agency staffs that you can always call on to replace or start in? For you need to look into all those things in contingency planning. Okay, so you create a backup plan where anytime a staff doesn't turn up, you have some agency staff or other staff to fill in the gap. Okay. Now we can also look into accurate forecasting. We didn't mention that in accurate forecasting, it becomes a crucial thing in the management of resource effectively. Now, by analyzing historical data and predicting future needs, care homes can ensure they have the right amount of staff, equipment, and supplies to meet resident demands. For example, during flu season, historical data can predict an increase in resident admission, allowing the care home to plan for additional staffing and resources through. Okay, so when there are area of COVID and flu seasons and all that, you are able to look into in the past the regular attendance of patients on that and those peak periods, and you can forecast or envisage how many patients will call on certain peak times. So Christmas times, people are not going to sick. So you're able to foretell that there will be a lot of visit by patients to the hospital or the care home, and therefore we can plan adequate staff to meet those needs. And then we use some tools in the planning process. Some of them are what we call the EHR, the software that you use in scheduling software and resource management systems to streamline operations and improve efficiency. EHR, for example, facilitates real-time tracking of patient care needs, while scheduling software helps in managing staff shifts, ensuring that there are no gaps in care. Okay. So the EHR looks at scheduling of staff shift rota, while the facilitated real-time tracking of patients' care needs, scheduling software help in managing staff shifts, ensuring that there are no gaps in care. That we need to look into what we call sustainability. In sustainability, we are talking about a sustainable practice that helps in reducing environmental footprint of care. Okay, those sustainability efforts might include using energy efficient lighting, implementing recycling programs, and sourcing eco-friendly products. These practices are not only benefit the environment, but also often lead to cost saving. Okay, they lead to cost saving. So you are looking into how you could save bills and other stuff for the care home. Okay, so you want to use energy efficient lighting systems and bulbs. You want to resort to recycling programs, eco-friendly programs that will not deplete the environment and ensure that the care home is also saving in cost and in bill. And once you are doing that, it gives you a total cost saving, okay, for the organization. And as a level 5 person, you might be in management or you might be one of the managers. Your duty is to ensure that these things are adhered to so you can save costs for the organization. Business continuity planning is essential to ensure that care homes can continue operations during and after emergencies. It involves creating detailed plans for various scenarios, such as power outages, natural disasters, and pandemics. For example, a care home might have a backup generator to ensure continuous power supply during outages. Okay, during outages. So while contingency is a backup plan, you are putting those things in so you can mitigate some unforeseen occurrences that may happen, power failure and all that. So you have a generator in place, you have things in place to ensure that when those things happen, you don't find yourself wanted. Okay. Then you go to staffing. We already mentioned about staffing when we spoke about HR management. Ensure that you use adequate staff, and qualified staff in Parliamentary to provide high quality care. This involves not only hiring and training staff, but also managing their schedules effectively to ensure these are always enough staff. Okay, using scheduling software, we spoke about that. We spoke about administration, where you have efficient administration support for all aspects of care delivery, very important. Okay, we give example that administrative system that automate the billing process, reducing errors and ensuring timely payments. Care homes always have administrative officers in place, and the reason that they look into the day-to-day activities of paperwork, ensuring that bills are raised, ensuring that patients that have been received are logged in and all that, and it helps in enhancing the organization. Okay. Good housekeeping, of course. If there is no good housekeeping in place, the whole care home organizations will be kept haphazardly. So there should be good housekeeping, maintaining a clean environment in the rooms of the patients and the surroundings. Okay, cleaning up, making sure that there's a checklist that is in place to check all those cleaning staffs are done rearranging of staffs in the care home. That is very key. We spoke about effective communication. Without a proper effective communication, collaboration among staff and residents, there will be issues within the care home. Okay, you have to implement a robust communication platform that ensures that information is shared promptly and accurately, which is crucial for coordinating care and responding to emergencies. Okay, contingency planning. Preparing for unexpected events is essential for maintaining operations during disruptions. This involves developing a contingency plan for scenarios such as short status equipment failures. For example, having a list of on-call staff who can step in during emergencies ensures that resident care is not compromised. Effective business and resource management in health and social care requires a multifaceted approach that includes accurate forecasting, technological integration, sustainable practice, and robust operational management. By focusing on these key areas, care homes can ensure they provide high quality care while maintaining efficiency and sustainability. Okay? Effective decision making in health and social care is crucial for ensuring that delivery of high quality care, efficient use of resources, and the well-being of both staff and service users. This process involves various types of decisions, the use of data and evidence, and the consideration of ethical values and attitudes. Okay, these are very important. Type of decisions. Okay, type of decisions. We have strategic decisions, which is more long-term, and deciding on expand services, merging with another organizations, or implementing new care models. Those are strategic. But we have the tactical decisions that is more medium-term decision that support strategic goals and typical environments, resource allocation. Okay. Example, planning staffing levels for a new service, budgeting for the next fiscal year, or selecting a new health information system. Definition, short-term day-to-day decisions that ensure the smooth functioning of the organization. Examples, scheduling staff shifts, responding to an immediate patient care issue, or ordering supplies. Scheduling staff shifts, responding to an immediate care issue, or ordering supplies. Evidence-based decisions. Definition, decisions informed by the best available evidence from research, clinical expertise, and patient preferences. Application, using clinical guidelines, research studies, and performance data to guide decision making. Okay, that is called evidence-based decision. Okay, it is based on evidence from research, clinical expertise, and all that. And those applications we are using clinical guidelines, research studies, and performance data to guide this decision making. Okay, then we can talk about the use of research. Definition, incorporating findings from scientific studies and data analysis into decision-making process. Okay, the application therefore will be that you are reviewing latest research on patient care technologies or techniques or new treatment protocols. Okay, those are the use of research. Okay, incorporating findings from scientific studies and data analysis into decision-making process. Okay. And we have data and analytics. Okay, collecting and analyzing data to inform decisions. Collecting and analyzing data to inform decisions. The application therefore will be that using patient outcome data to improve care practices or financial data to budget effectively. Okay. Influence of ethics, values, and attitudes. Ethics. Definition is that moral principles that guide decision making to ensure fairness, justice, and respect for individuals. Application. Ensuring patient confidentiality, informed consent, and equitable access to care. Okay. Ensuring patient confidentiality, informed consent, and equitable access to care. Values. Definition. Core benefits that influences priorities and actions. Application. Prioritizing patient-centered care, value teamwork and collaboration, and committing to a continuous improvement. Okay. Prioritizing patient-centered care, valuing teamwork and collaboration, and committing to continuous improvement. Okay. Personal perspective that affect decision making. Application. Fostering a positive attitude towards change, encouraging openness to new ideas, and promoting a supportive work environment. Identify decisions. Definition. Recognizing the need for a decision and defining the problem or opportunity. Assessing situations that require intervention, such as staff shortages or patient care issues. Use of research. Definition, gathering and analyzing relevant information to understand the context and implications. So we have application, conducting literature reviews, consulting experts, and reviewing internal data. Okay. Identifying solutions and options. Definition. Generating a range of possible solutions or courses of action. Application. Brainstorming sessions, seeking input from stakeholders, and reviewing best practices. Evaluating solutions. Assessing the feasibility, risks, and benefits of each option. Application. Conducting cost-benefit analysis. Risk assessment. So evaluation definition, assessing the feasibility, risks, and benefits of each options. Applications that you are conducting a cost benefit analysis. You're trying to look into risk assessments and then the impact of evaluations. And the learners are able to, students should understand that those are things that you would have to use in ensuring that you meet those. Okay, those are evaluating solutions, cost benefit analysis, and ensuring that all those things are met. Okay, so whilst you have assessed the feasibility, the risks, and the benefit of each options, you then use the cost benefit analysis to ascertain the evaluating solution. Okay, so you are looking at the cost and the benefit that will help the organization. Okay, while the identifying solutions and options, you are generating a range of possible solutions or courses of action. Okay. Then we have involving the right people, very key. Engaging stakeholders who have expertise, interest, and authority to contribute to the decision of the care home or organization. We have already mentioned that when we talk about stakeholding, we have internal stakeholders and external stakeholders. And these two categories of stakeholders, they are always people within that can help to enhance the profitability of the organization. Okay. Where the internal ones, we did mention that the patients family, patient themselves, decision administrators, and all that. Externally, you may have some care agencies that you may use externally, all help. Okay. Making a decision, of course, selecting the best option based on the evaluation of solutions and input from stakeholders. Okay. The application will be that you are reaching a consensus or making a final decision through leadership. Reaching a consensus or making a final decision through leadership. Okay. Okay. You have to look into the implementing decisions. Okay. Putting the chosen solution into actions through developing an implementation plan, allocating resources, and assigning responsibilities. Evaluating the decision and process. Definition. Reviewing the outcomes of the decision and the effectiveness of the decision-making process. Application. Collecting feedback, analyzing results, and making adjustments as necessary. Okay? These are things that we need to know. Collecting feedback, analyzing results, and making adjustments as necessary. Okay? Repetition, reviewing the outcome of the decision and the effectiveness of decision-making process is very, very key. Okay? So one, identifying decisions. It's important is that we are able to recognize a decision is needed in the first stage in addressing any issue or opportunity effectively. So you are able to identify those first stage decisions. Okay. Then you can put an approach to it. Then you can organize regular assessing the environment and operations to identify areas that require those decisions. So you put into assessing environment and operational, see which areas cause those decisions that you have identified, okay? Then you can use research that we've clearly spoken about. Research, you say research provides evidence that can inform decisions, making them more likely to be effective. The approach is that you are able to gather data from reliable sources, consulting and experts, and use those data to understand the situation. Use those data to, to formulate things that will help in the decision that you want to take for that particular situation, okay? We spoke about involving the right people. What are its importance? It helps to engage stakeholders to ensure that decision-making process is informed by diverse perspective and expertise. How? By identifying key stakeholders and involving them through meetings, consultations, and feedback mechanisms. So it's making the decision. Important. A clear and well-considered decision ensures that actions are taken in a timely and effective manner. Approach. Weighing the evaluated options, seeking consensus, or making an executive decision based on the gathered information that you have gotten. Okay, this is how you're able to make a decision because you are able to utilize the information you have gathered and put them into practice. Then you have to implement those decisions as well. You implement them by detailed implementation plan, assigning responsibilities and allocating necessary resources. Okay. We then have to evaluate the decision and the process that we have chosen upon implementation. There should be continuous evaluation of the decision that you have made, that we have putting them into practice. Okay. And we do that by collecting feedbacks. Of course, once you've implemented a decision in the care home, there should be feedback, from workers, from management, from other staffs. And then those feedbacks, you write them down, you put them down for future decision makings. Okay. Okay. A positive value-based culture in health and social care is fundamental for delivering high quality, compassionate care that respects and upholds the dignity and rights of service users. Such culture impacts the management of health and social care services by fostering an environment where ethical values and principles guide every aspect of care and operations. Okay, it's very important. Okay, so you need a positive value-based culture, a positive attitude. Okay, that resonates or connects with compassionate care that respect and upholds the rights of service users. Okay, such culture impacts positive of health and social care services by fostering an environment where ethical values and principles are adhered to. And we all know person-centered care, where it is more about the care of the person to allow the person to be more independent rather than you, the carer, what you think you want to do. Okay. So person-centered care is more about individual needs and their preferences and choice. The impact thereby is that it improves the person's patient satisfaction and outcome by making care more relevant and effective surrounding the patient. Okay. More of the patient preferences and all that. And you ensure that care plans are developed in partnership or in consultation with the patients, very important, and their families, or probably the next of kin. Okay. In person-centered care, there should be mutual respect. There should be dignity. Okay. There should be dignity. There should be trust, and there should be confidentiality. Okay. Confidentiality, protecting the patient's information from unauthorized persons or individuals. Very, very important. Okay. Privacy, very important. Ensure that service users feel safe and respected. It is very crucial, okay? Providing private spaces for personal care and consultation, ensuring that patients' place of sleeping and all that is well protected. Empowerment, okay? Empowerment, enabling individuals to take control of their own care and make them. I spoke about independence. When person-centered care, one of the key things it seeks to do is to promote independence so that patients can do things on their own. All you do is to empower them or encourage them. Safeguarding, you are protecting the patients from abuse, harm, and neglect, okay? This ensures safety and well-being of service users, maintaining integrity of the care environment, very important. Inclusion, you are promoting equal access to care and opportunities regardless of the background or the circumstances, okay? And you have to implement policies that surround itself in inclusiveness and diversity, okay? The impact is that it fosters a culture of quality and respect, providing access to care and services for all individuals. Well, then we have what we call the enhanced quality of care. You adopt a value-based approach that ensures that practices are aligned with ethical principles, leading to higher quality of care, okay? The result will be that it improves patient outcomes and satisfaction, okay? Improves staff morale and retention, yes, of course. You create a respectable environment for staff to work in. You know, it results in a stable, motivated workforce, which enhances continuity of care, and thereby staffs are happy and they don't resign, okay? Increase trust and engagement. You know, transparency, consistency, communication builds trust within service users and their family. It results in greater management and cooperation, okay? Compliance with regulations, you know, adhering to safeguarding regulations, security regulations, and all that. It stops or prevents against legal issues and improvement of reputation, and also help the staffs to be happy so that there are no only legal issues that affect the staffs, and it does not lead to resignations or staffs not happy, but it leads to continuous improvement of care and retention as well. Where sustainable practice, we spoke about doing things that, you know, complies with the environment, you know, comply with recycling modalities and all that. So it's very important that when you do all those, you are inspiring service users and promote a positive culture that fosters long-term sustainability. The result, therefore, with that, a resilient and adaptable care environment is chosen, because in sustainability practice, we are trying to make the environment very safe and free from devoid from any other thing. Okay. In conclusion, we spoke about positive care. We spoke about the approach that is only enhances care outcome, but also fosters a supportive and sustainable work environment. We spoke about focusing on person-centered care, mutual respect, dignity, confidential. They all help in patients' independence, okay? Then we look into balancing profit-based approaches with positive values. Based culture in care homes involves integrating ethical principles and business strategies to ensure both financial sustainability and high quality care. This balance is crucial for creating an environment that supports both the well-being of residents and the financial health of the organizations. Establishing shared views, shared visions, and objectives. The strategy. Create a unified vision and set of objectives that align financial goals, value-based principles. The application. It develops a mission statement that reflects both the commitment to high quality care and financial sustainability. The impact, therefore, is that it ensures that all stakeholders are working towards one common goal, what we call shared goals, that integrate ethical care and financial stability. Very, very important. You don't have to set priorities right. Your priorities must be set right. There must be a strategy that prioritizes initiatives that simultaneously improve care quality and functional performance, okay? Then we have the application. Focus on areas such as reducing waste, improving efficiency, and enhancing care quality to achieve cost savings. The impact, therefore, will be that you align resource allocation, with dual goals of profit and values-based care. Okay, those are the impacts when you have set your priorities right. Okay, you are able to implement systems to monitor performances and identify areas for improvements. Okay, areas for improvements. The application with the use of performance metrics and regular audits to assess both care quality and financial outcomes. Okay, the impact facilitates ongoing improvements and ensure that both care standards and financial goals are met. Strategy: identify and promote best practices that exemplify both high quality care and efficient operations. Application: share successful strategies and practices across the organization through training and workshops. When we're talking about best practices, we are looking at the best things that the organization needs to do to help the patients or to help the staffs. So those best practices, one of those are through trainings and workshops and all that. Those are best practices that you have to ensure that your staffs are using and complying with. That will end up helping the patient on the services as well. It then encourages a culture of excellence and continuous improvement. Okay. When you have to identify the personal skills, values, and attitudes, you are able to, the strategy is that you are able to recognize and develop the skills and values of staff that contribute to a value-based culture. The application will be that you provide training and development opportunities that emphasizes on ethical care and financial management. The impact will be that it builds a workforce that is skilled, motivated, and aligned with organizational missions and values. Okay, it builds a workforce that is skilled, motivated, and aligned with organizational missions and values. Strategy: that it fosters a culture of trust and accountability through transparent practices and clear expectations. Application: okay, the application therefore be that is you implement policies that promote ethical behavior and hold staff accountable for both care quality and financial performances. Okay, once you're able to identify areas of improvement and you seek to put them on trainings and workshops on best practices, then you can hold them accountable when they decide not to practice those things that they have been trained for. The impact is that it creates a reliable and accountable work environment that support both ethical care and financial goals. Okay. What then will be the implementing strategies? One, identify behavioral and organizational process of changes required. Conduct a thorough assessment to identify necessary changes in behavior and process that support both value-based care and financial sustainability. Okay, you have to identify changes that may occur in behavior. You see, around staffs, just as you're able to tell the behavior change for patients as well. And the application will be that you're able to introduce changes in workflow, communication, and decision-making process to align with a shared vision. You then have to set aims and objectives. Okay, every strategy must have aims and objectives, what you seek to achieve. Okay, you define those specific measurable aims and objectives that balance financial and care quality goals. The application therefore is that you develop short-term, long-term goals that integrate profit-based and valuable-based priorities. Communication, vision, and mission. Implementation. Clearly communicate the organization vision and mission to the stakeholder. It is very important that everybody within the organization knows the visions and missions of the care home and organization. How do you do that? In meetings or when your staff is being employed, you ask or you tell them about those visions. You put them in the handbooks when you have employed them. Okay, use training sessions. All these things are ways that you can use to ensure that they are much aware about their visions and the missions. Okay. Adapting in response to evaluation and feedback. You see, establish mechanisms for regular evaluation and feedback. Okay. Use feedback from staff, residents, families to make necessary adjustments and improvement. Okay. Adapting leadership style. Implementation. Place leadership style to support both financial and care quality goals. Application. Use transformational leadership to inspire and motivate staff, and transnational leadership to ensure compliance and efficiency. Okay. Use transformational leadership to inspire and motivate staff, and transactional leadership to ensure compliance and efficiency. Okay. So let's look at establishing shared vision and objectives. A shared vision is just like a shared goal that aligns all stakeholders and guides decision making. This ensures that financial goals do not overshadow the commitment to high quality of care. The approach, therefore, would be that you're able to engage stakeholders in developing a mission statement that reflects both values and financial sustainability. Regularly revisit and reinforce this vision through meetings and communications, okay? Through meetings and communication. So you have a shared vision that aligns with stakeholders and guides the decision making. However, you develop a mission statement that reflects both the values and the financial sustainability, okay? Speak about vision and mission. So the mission statement will guide those shared visions, show shared vision that you are fitting. So statement will guide will be the blueprints, okay, that ensure that all stakeholders will follow the mission statement, okay. Setting priorities, importance. Prioritizing initiatives helps in focusing efforts and resources on the most impactful areas. The approach. Evaluate potential initiatives based on the ability to improve care quality and financial performance. Implement those that provide the greatest benefits in both areas. Okay. Implement those that provide the greatest benefits in both areas. Monitoring and continuous improvement. Importance. Continuous monitoring and improvement ensure that organization adapts to changing needs and maintain high standards. The approach, therefore, will be that you use performance metrics to regularly assess both care quality and financial health. Implement improvement plans based on this assessment. See, so you look at what we call performance metrics to regularly assess the care quality and financial. Others may use what we call appraisals. Okay, appraisals could be used also to ascertain the performances of carers and the staffs within the organizations, so that it helps you to implement improvement plans where the need may be. Okay, all right. Modeling and sharing best practices. The importance, therefore, will be that you promote best practices in standardizing high quality care and efficient operations across the organization. Okay, when you're able to promote best practices, it helps to standardize high quality of care. Okay? High quality of care. The approach is that you identify successful strategies and practices within the organization, share them through training and workshops. Okay. The importance will be that you are able to develop the right skills and values in staff and support a positive culture, staff performance. The approach will be that you provide training and development opportunities that focuses on both ethical care and financial management. Importance. Trust and accountability are foundational for a positive work environment and effective care delivery. The approach. Implement transparent practices and policies and hold staff accountable for their performance in both care and financial aspects. Okay. Identifying behavior and organizational process changes required. The importance will be that you understand what needs to change is crucial for successful implementation. Okay. How? By conducting assessments to identify necessary changes in behavior and processes, and to introduce changes gradually and support staff through the transition. This we can talk about change management. Once you identify those changes, you ensure that you don't just push the changes that you have done on them, but you take them through step by step, you take them through in managing those moments of change management. Okay. When you set your aims and objectives, what does it do? Clear aims and objectives provide direction and measurable targets. Some of the approach we know about is you can use the SMART goals, measurable, achievable, SMART, specific, measurable, achievable, relevant, and time-bound goals that integrate both care and financial priorities. Okay, the SMART goals can be used to achieve your aims. And SMART goals are specific, measurable, achievable, relevant, and time-bound goals. Okay. Communicating vision and mission. The importance we spoke about is that effective communication ensures all stakeholders on the same level. Okay. And they become partakers of the shared vision and objectives. How do we do it? We use various communication methods, including meetings, newsletters, training sessions, and all that. Okay. Adapting in response to evaluation and feedback. Okay. We've spoken about regular evaluation is important, so you can know what strategies you can put in place. But how do you do that? You establish mechanisms for collecting feedback from the carers or from family members, evaluating those outcomes. Use this information to make necessary adjustments. Adaptive leadership style. Importance. Different situations may require different leadership approaches to be effective. We spoke about transformational leadership style that inspire and motivate. That's the best kind of leadership. We have the situational leadership, but the transformational leadership is the best because in transformational leadership, you motivate and inspire the staffs to do things right. Okay, so those are the best type of leadership that is good when it comes to staff engagement and decision making. Okay, so we'll come to the end of the lectures. These are the references that you may have it on your student model. We expect you that you go through the model, listen to the recordings, study more, and we will have assignment discussion. Then you should have started your assignment submission from 2 weeks from when you had the assignment discussion. But then by now, based on the lectures you have done, you can look into what has been done so far. You can start to look into some of the questions that comes with every unit that we have covered and start attending to them. But there will be assignment discussion, and after the assignment discussion, you will need to sort of start your assignment and submit it 2 weeks after the assignment discussion. Okay. Any questions at all?
None for now.
Okay. Well, I will bring the lectures to an end then. Okay. Thank you.
Thank you.
Bye.